Medical pluralism. So, medical pluralism really is this coexistence and interaction of multiple diverse healthcare systems, practices, and beliefs within a society. Different indigenous, immigrant, and other cultural systems come into contact historically and often coexist in shared communities, societies, and nation states. So within these contexts, anthropologists see where individuals may benefit from a range of conditions, treatments, and so on that are offered across these systems, but also the idea of challenges that can be seen in conflicting recommendations across healthcare systems. Having some upper back pain, and should I seek Western medicine or should I seek traditional Chinese medicine? If I'm thinking about my doctor wants me to undergo physical therapy, to take pain medications, and possibly surgery. At the same time, knowing people within the traditional Chinese medicine world, it may be an imbalance in my body's vital energy, qi, things related to blood circulation. So acupuncture, herbal remedies, massage may be able to restore harmony and alleviate the pain. Obviously, these are different ways of looking at things in terms of illness and treatment. Each of these reflects very different approaches to illness. And for somebody like myself, I respect both as equally valid. And so then the issue of which recommendation to take becomes something for us to think about. For me, in fact, with the way my insurance is, I do not believe that I would be able to finance working with a Chinese traditional doctor. Without the insurance, I would have to pay out of pocket. And so that may be a financial burden. So if you're thinking about my decision making, it may not be because I prefer biomedicine, but that my insurance only allows me to seek a particular kind of care. So when we're thinking about medical pluralism, we're also thinking about plural and syncretic, right, healing traditions that coexist in society. We've talked about biomedicine. We've talked about varieties of ethnomedicine. You can think about the pluralistic kind of interaction between them. At the same time, there's really a whole other realm that's developed of alternative and complementary medicine, in which ethnomedical practices, treatments, therapies really exist alongside and in conjunction with biomedicine. This can be an incredibly syncretic approach that sees things taken from all of those traditions, right, and combined. One of the themes that has been really seen is the way that alternative and complementary medicine comes at things by looking at the kind of holistic concept of illness, with the mental and psychological aspects of the mind, the body, and the biological, as well as this kind of spiritual of illness. And that if you're thinking about a common theme, that these alternative and complementary medicines will really focus on all of those components of an individual's well-being. The really interesting thing too is it's so dynamic and changing and so varied. So for example, we could consider the Institute of Complementary Medicine. This is a really interesting institution. I would classify it as an alternative or complementary medicine institution, and they do many different kinds of medicine, from, as you can see, acupuncture. They have naturopathic medicine. They have experimental kinds of medicine that have not gone through test trials. It's an incredibly interesting hospital. It's one of these examples where different kinds of, or we could say, biomedicine and ethnomedicine and experimental forms of medicine kind of come together. So when we're thinking about medical pluralism, there's also a couple factors that we see that influence how medical pluralism is understood in a particular context. There's just a human diversity in suffering and healing leads also to differences when we look at how a society or what options that a society offers individuals for medicine. You have a factor of the accessibility and affordability of healthcare. So this is going to affect how pluralistic a society as healthcare may be. We should think about the historical and political context, things like the colonial legacies and government policy. So here in the United States, many Native American communities, children were removed, right, from the home and the community, and indigenous ethnomedicine was actively suppressed and discouraged. And so many native people grew up without practicing or learning about traditional healing methods. So, this is one of the factors you could think about in trying to understand a kind of medical pluralistic landscape. So, trends and directions when we're thinking about medical pluralism, this is clearly something that's only going to continue to develop with the modern world system, globalization, and so on. This exchange of different kinds of healing knowledge. And so there's a lot of talk about integrative medicine and potentially this idea of collaborative care models where representatives from the different multicultural, medicine providers, healthcare providers can form teams to provide comprehensive care, to the idea of collaborative care model being something really about emphasizing the communications between, right, these healthcare providers and giving potential recommendations to the patient, having better coordination and collaboration among them. So if I'm working with a traditional Chinese medicine healer and I'm also working with my doctor, if they were able to, as part of a collaborative care model, communicate, share notes, and so on, this could be of great benefit. I think that's where anthropologists, when we're giving policy kinds of recommendations, it's a model we would be advocating. And I've spoken a little bit about traditional Chinese medicine, and in thinking about medical pluralism, China, in fact, is a really interesting context to explore for medical pluralism. In China, there is this idea of an integrated Chinese and Western medicine. So you have something like, you could say, Western biomedicine, hospitals, schools, set up institutions, right, associated with that. And then you have traditional Chinese medicine, which also, again, has schools and hospitals, clinics, pharmacies, and a population that seeks that kind of care. But they also have, thinking again pluralistically, I'm not going to be comprehensive, but a third system that is available is this integrated Chinese and Western medicine, where it's oriented towards the goal of balancing the body's energies and optimizing the flow of vital energy or qi. So it has this kind of grounding in traditional Chinese medicine, but people may use a range of different diagnostic methods, physical examinations, laboratory tests that we would associate with biomedicine, as well as traditional Chinese techniques like pulse and tongue diagnosis to really assess, the patient's conditions. You may have treatments that have things like pharmaceuticals, surgery, physical therapy, as well as herbal remedies, acupuncture, cupping, dietary therapies, and so on. And so in this integrated Chinese and Western medicine, well, they don't frame it like academics here, this collaborative care model that we just spoke about. In fact, that's what they do. And so a patient will have a team, will have a biomedical doctor, will have a traditional Chinese medicine practitioner, and potentially other specialists. So to conclude here, the concept of medical pluralism, right, the opportunities and challenges that it offers human beings, kind of some of the trends and directions that we're seeing. Integrated medicine is one of those. And then finally, we ended with that example, right, of integrated Chinese and Western medicine that you can find in the People's Republic of China.